Ellen Sonnenberg, and I'm here to talk to you about support of the SAVE Act, Senate Bill 175 for North Carolina. I am addressing Bobby Hanig. He's a senator from my area of northeastern North Carolina, where I live in Woodland. And what this act does is it gives nurse practitioners or any advanced practice nurse the option to, well, the ability to practice without that physician oversight, which would be great because we need our nurse practitioners, and lots of states already do this. So why not? Why aren't we doing this, Bobby? Let's do it. Let's support Gail Adcock in getting her legislation passed. My own personal experience is I also see a nurse practitioner, and I actually prefer to see nurse practitioners. It's just I feel like they spend a little bit more time with me and listen to me and provide that great bedside manner. So, but that's just one of the small reasons. You know, I know of a provider who's a physician who has an office in the next county over who has several other nurse practitioners working for him. And of course, he is the business owner and the other nurse practitioners have to work under him. So let's give those nurse practitioners an opportunity to have their own clinic if they want one. You know, it doesn't have to be a physician. Let's talk about why. Why can they do this, or should they do this? Well, you know, when you look at according to King 2023, nurse practitioners pay a lot of money to have physicians sign off on their work when they're working separately from that physician. There was a clinic in North Carolina that paid $30,000 to a physician for 15 minutes of his time just to literally sign off on their work. That's I don't know any other job that can pay that much. $30,000 for 15 minutes? Are you serious? Access to health care, that's another great benefit. According to DePriest et al. 2020, you know, when you're looking at underserved populations, this is a great need. We need to provide that accessibility to health care. You know, we need to bring those primary care providers to the rural areas. And part of that is having nurse practitioners in that picture. And because we do have nurse practitioners, but if you don't have a physician there to sign off on their work, they can't practice. So let's do it. And you know, North Carolina right now is still, requesting that physician oversight. You think about COVID-19. According to Moore et al. 2020, Alex Azar, Health and Human Services Secretary, did during that time ask if the states would lift that regulation so that nurse practitioners could see patients and provide more care during our pandemic. And it was up to each state. However, it was a great need. We need that help. We need especially during times of pandemic. But if we had already had that in place, we wouldn't even had to think about that. And thinking about outcomes, the outcomes they're great for nurse practitioners too. According to Harrison et al. 2023, when they looked at adult diabetic patients, nurse practitioner care outcomes versus those physician care outcomes, there was no significant difference. Those A1Cs were comparably the same. Yeah. Same for those pediatric asthma patients when they looked at admission rates for rehospitalizations for asthma. They were about the same. So the outcome for primary care, that is essentially not going to change with when you switch over to nurse practitioners. So that is great to hear. Of course, there's going to be opposition as with anything. So Patrick Burns with the North Carolina Patient Safety Group, states there's several reasons why doctors, I say doctors because that's who's primarily opposing this, don't want this. They say it removes physicians from patient care. Not true. It provides more patient care, but you still have the option to go to a physician. There puts risk for patient safety. That's not true. I work in a hospital, and I know nurses care a lot about patient safety. Increase healthcare costs, false. We will save money. Those nurse practitioners who are saving that money could put it towards patient care if they wanted to and actually give patients things that they need. It does not increase access to care, false. If you put a care provider in a rural area, that increases access to care. So yes, it does increase access to care. So Patrick Burns with North Carolina Patient Safety is not correct in those things. And not surprisingly, the people who are supporting him with this group against a SAVE Act are people of the Medical Society and the College of Specialties of different types of areas that physicians practice in. There was one nurse practitioner article that I found, and this was Gardner et al. 2021. Loretta Ford said that she was not in support of the SAVE Act because she became a nurse practitioner during a time when, it was pretty new. So she did get physician training and she supports physician training nurse practitioners. However, she did also acknowledge that there could be room for change. There is a need for change. So I want you, Bobby Hannig, to think about supporting Gail Adcock in her primary sponsor role for Senate Bill 175 for North Carolina. Please, you'll be doing us a service.